Hello everyone. So today we are going to discuss a case of disproportionate golden proportion. We are all aware of golden proportion. That this lateral incisor should be 62% of the size of the central incisors. So here I'm going to do the interproximal reduction of the central incisors for the reason that the height to width ratio is slightly disturbed, and the proportion between the size of the central incisor to lateral incisor is slightly disturbed. This case is near the finishing state, and the parents are of the concern that the central incisors are slightly proclined or protrusive. However, the inclination, as you can see on the smile, can you please smile? The inclination on the smile seems fine, and on the lateral view, the inclination seems okay. So, but because of the slightly increased size of the central incisors and triangular morphology of this tooth, we are planning interproximal reduction to develop the proportionate between the size of the central to the adjacent teeth. So we have planned 0.5 millimeter of interproximal reduction on this spot. On this spot, 0.5 millimeter, 0.5 millimeter on this spot, and 0.5 millimeter on this spot, and the situation is quite favorable for doing the IPR. With this measuring gauge, we are going to measure the 0.5 millimeter space that will be gained after doing the interproximal reduction, and we are going to use the burs, the handheld strips, and the handheld polishing strips for the moment. As we are aware that these are the interproximal burs, and for the anterior IPR, we are supposed to use this particular burr for the central incisors, and for the posterior IPR we have to use the longer IPR. And for the finishing, these two with the yellow mark are the finishing burrs. So let's start the procedure. The first thing, the most important thing, you need to have the pre-check that the handpiece is having optimal flow of the water, because you need to protect your pulp and you need to make sure that the temperature is not increasing while doing the IPR procedure. So first of all, we are going to use this burr. The diameter of the burr at the tip is 0.1 to 0.2 millimeter. So for us, the placement of the burr is really important. The burr is designed according to the embrasure spaces of the central incisors. Burr is never going to place like this, because if you place the burr like this, that is going to change the incisor embrasure space. Okay, so the position of the burr should be lateral approach. Lateral approach, something like this. This is called the lateral approach. First of all, we need to understand where is the connector area. Connector area where the two teeth appear to be connecting each other. This is the contact point, and this is area, the connector area. What you can appreciate over here, this area is the incisal embrasure, and this area is the gingival embrasure, and this is the connector area which we are going to do the IPR today. This burr is going to be placed from the lateral approach from the labial embrasure below the connector area into the gingival embrasure space, like this. Second most important thing, the burr is not passed through and through. This burr will not pass like this. Okay, this will go almost the halfway into the connector space, and there will be the light brushing motion of the burr. Okay, let's proceed with the IPR. Double check the water display. Okay. Open wide, open wide, open. And that's it. We have done the IPR over here. The next, the line angle, point angle, we will adjust with the help of the handheld strip. Now, before we develop the line and point angles, we are supposed to double check the size of the IPR which we attain. So this is a 0.5 millimeter strip, and we are checking it with this. This is slightly passing, comfortably passing through this without any pressure. So this means we have accurately achieved the 0.5 millimeter space, and this is not but with my personal judgment, I like to go slightly increasing. It's 0.5 millimeter. You see over here, this is 0.5. Okay. So moving on, the same procedure on the distal aspect. So now I'm proceed without the demonstration and focused on this. So my focus is more on the central incisor shape. Split cut. Short. This is 0.4. 0.5 is slightly tight. Open. Split. Okay. Tight. Open. First, we check the connector area. This is the incisor embrasure. This is the gingival embrasure, and the burr is passing through it. So the movement the burr will look like. Okay. The next step is, before we proceed to the contouring of the line angle, point angle, we are here to verify the space gained. Here the idea was to gain 0.5 millimeter space from each contact point. So this is comfortable passing. So this should be the criteria. It must go right angle and it should be easy. Okay, and this is comfortable, and this. If you carefully see, we have slightly modified the contour and the shape of the central incisors, and now it will not look slightly bigger as compared to the central incisors. The next step is contouring. For this, I am going to use this handheld strip. So this is the length. I am intentionally using a slightly bigger size of the you see this strip is loose. So this loose strip will make sure that is passing like this around the line angle, and I could be easily to make the contouring the line angle. So if I'm going to round off this mesio-labial line angle, passing like this, totally flexing around it, and the position is like okay. That's fine. The next step is the polishing. Open, open, beta product. 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 Better. Barakuda. Open. 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 Now if we closely focus, now you see the line angle, point angle of these teeth after doing the IPR. It must reproduce the proximal anatomy like this. Open. All the anatomy should be reproduced in a very nice focus. And in the last, double check with the strip or anything that it is very fine. You can check, ideally you can check with the help of the floss, but even this is handheld strip can be used to check the openness of the contact point, and I can appreciate and feel the nicely contoured and smooth surfaces of the teeth. That is prerequisite. And the last step is the fluoridation. I am going to shift this patient on the aligners, and when I will advise aligners, the patient I will advise to use the fluoride along with the aligners. That will help developing the development of the fluoroapatite crystals over the surfaces of the newly polished surfaces of the enamel. So the fluoroapatite crystal will be more resistant to the caries. So for the prevention of the caries, it's more important to have, we must not be having any ledge, any furrows, any plaque retentive site on the surfaces of the enamel. That is the prerequisite for having the long-term good periodontal health, and for the resistance of the caries, there must not be any plaque retentive site, and the development of the fluoroapatite crystals on the surfaces of the enamel will help prevent the development of the caries in the future as well. I have just removed the brackets, so the mark of the composite on the tooth surface is there. So please ignore that, but today our focus is on the proximal side of the teeth. These are the nicely polished one after doing the IPR. Thank you very much. That's all for today.